I'm worthless. I need an escape. Nobody understands me. How did I let this happen? I'm out of control.
911, what's the nature of your emergency?
Ma'am, can you hear me? Can you hear me?
The heroin epidemic. In 2015, Ohio, California, Pennsylvania, and Florida had the highest number of deaths from overdose as compared to every other state. Ohio totaled 3,310 deaths in 2015, and that number is still growing. Of those 3,310 deaths, almost half are due to heroin overdose.
Hey, can you hear me? Can you wake up? Alright, I'm gonna give 1 milligram Narcan per nostril. Alright, it's in. Put some oxygen on.
Where am I? Where am I?
You
Where am I?
It's not heroin.
No, where am I? Where are you taking me? I don't want to be in here.
It's okay, we're going to the hospital.
No, give me my drugs back. I want my drugs. What are you doing to me?
Here's a bag.
Naloxone, antidote for opioid overdose. Onset is less than 2 minutes when administered intravenously. The duration is 20 to 90 minutes, and it can be used by non-medical personnel. Handheld auto-injector called Evizio IM injection. Nasal spray is also available. Overdoses can be a life-threatening situation, so getting help immediately is first line of treatment. Call 911 right away. Symptoms from injected heroin overdose can appear in as little as 10 minutes after the dose was taken.
Alright, what have we got?
This is Candy Johnson, a 16-year-old female found behind the warehouse. Unresponsive, there's needles all around her. We got her an ambulance and gave her 2 milligrams Narcan intranasally. Her last vital signs were 128/80. Respirations are safe and shallow. Her heart rate is 108 and her temperature is 93.2.
Okay, did she respond to the Narcan at all?
Yes, she was very combative and wanted her drugs and did not want to go to the hospital.
Signs and symptoms of opioid overdose: respiratory rate less than 12 breaths per minute, hypotension, pale skin, cyanosis of the lips and the tips of the fingers, weak pulses, extreme drowsiness and unable to be aroused, coma, and nausea and vomiting.
Alright, I got Narcan, 4.4 milligrams per doctor's order. Okay, we're going to get an IV push.
O2, 6 liters, nasal cannula.
Okay, Narcan is in. Candy! Candy, can you hear me?
Who are you? Where am I? Where am I?
Candy, it's okay. Candy,
Where am I? Stop touching me!
You are in the ER.
Stop touching me!
We're in the emergency room.
No!
Candy,
Candy.
it's okay. It's okay.
Where are my drugs? Give me my drugs back!
Candy, I'm going to pull out your IV.
I don't care!
Look at me. Look at me.
Okay,
Look at
stop.
me. Look at me. Open your eyes.
Slow down.
You are
Where
in
am I?
You are in the emergency
Why?
room.
Who brought me here?
Somebody found you on the side of the road, passed out. They brought you in. You had an overdose. Okay. We're
Get
gonna
me out
get
of
you
here.
help.
Get me out of here.
We gotta give you
Get you-
things right now. Okay.
Yes.
You're very
You're suffering
hypothermic.
from hypothermia. We're going to get you some oxygen. We're going to get you warmed up with blankets, with warm blankets.
I don't need to be
You're at a
here.
dangerous level.
I don't need to be
Candy, your
here.
temperature is 94 degrees right now. We gotta get you warmed up.
That
Okay.
means nothing to me.
You're very cold right now. Okay. You're out in the cold. We have heat packs that are gonna go under your arm and right around your groin and stomach. Okay.
Why are you touching me?
We have to get your tin warmed up. Okay.
What is this?
That's your
That's your
Candy,
oxygen.
I don't want it.
That's your oxygen.
You're not getting enough oxygen.
Okay, we have to get your respirations back up. You're losing oxygen. Okay, we got your IV running to get you some fluids,
What are you
okay?
giving me?
We're just giving you some normal saline right now to get you rehydrated,
And we're going to get some warm blankets.
okay?
Signs and symptoms of hypothermia: Early signs are cold feet and hands, puffy or swollen face, pale skin, shivering, slow speech or slurring words, and agitation and confusion. Some late signs of hypothermia is moving slowly, trouble walking, or being clumsy, stiff and jerky arm or leg movements, bradycardia, bradypnea, and loss of consciousness.
All right, looking up for Dr. Bonnie Balone is on call tonight. Hi, Dr. Balone. This is Emily Cullen from the ED. I just want to make you aware, we had a patient that was brought in with a possible believed heroin overdose. She was brought in with a BP of 124/80, pulse of 104. Her temp was at 93.2, respirators were 6, and Glasgow coma of 4. We started O2 on her at 6 liters to bring her SpO2 up. And we began hypothermic measures. We put heat packs on the groin, armpits, and abdomen, and heated blankets as well. What would you like us to continue with her? Okay, so we'll draw stat EBG labs. We'll continue O2 at 6 liters a minute until she reaches 98%, and we'll continue our hypothermic measures as well. Okay, and I'd also recommend that you come down and see her as soon as possible. She was a little bit combative at the scene. We were able to talk her down. Restraints weren't needed. But she's still pretty confused and disoriented, so if you could just come down and take a look at her, that'd be great.
Hypothermia is an emergency condition that can quickly lead to unconsciousness and death. Medical treatment depends on the severity of hypothermia, and emergency treatments include the following: covering the patient with warm and dry blankets, removing wet or cold clothing, rewarming the patient's blood, and running warm intravenous solutions, as well as placing heat packs under the armpits and near the groin, and airway rewarming using warm, humidified air.
Okay, Candy, Linda's going to check your blood pressure right now, okay?
What are you doing?
She's checking your blood pressure. She's got to see. I'm going to listen to your lungs, okay? Do you know how much heroin you took?
A couple syringes.
Okay. Do you know what time that was approximately?
I don't know, whenever they found me by the dumpsters.
Okay. Her respirators are up to 24.
I got 114/88
All right.
for blood pressure.
All right, I'm going to go give the doctor a call. Call me if you need me, okay?
I really don't think I need this oxygen.
Yeah, we
It's
need to know
really
the
annoying.
oxygen. Your oxygen is low. We're starting to get back up. It's starting to come up to about 97 right now.
So
need
then
to
we
get
can
it up
turn it
just
down.
no, we need to keep it just like that for just a little bit longer. I need to get a rectal temp. We need to get an accurate temperature. You have hypothermia, and it's a very serious condition, and we need to get an accurate temp.
And you're
to
gonna
make
do that
sure
how?
we're going to do it rectally. Emily?
Yep.
Yeah, about that.
Yeah, I know. It's not the best thing.
A rectal temperature is considered the most accurate measurement of body temperature. The steps to doing so is as followed. Provide privacy for the patient, as well as performing proper hand hygiene. Place the client in Sims position with upper knee flexed, and adjust the sheet so only the anal area is exposed. Lubricate the tip of the probe and instruct the client to take a deep breath before you insert the probe gently. You should approximately insert this probe 3.5 centimeters for an adult, and do not force the probe if resistance is met.
Hi, Candy. I got an order from the doctor. We're going to get some ABGs, so I just want to ask a couple questions. What's your name and date of birth?
Candy Johnson,
And what's your date of birth?
7/31, 88.
Okay, do you know where you are?
Some hospital.
Okay, do you know what you're here for?
They brought me here, I don't know.
Okay. Alan's test was positive. We're going to do some.
The Allen's test. Before drawing ABGs, an Allen's test must be performed and be positive. The steps of the Allen's test are as followed. Ask the patient to raise their hand and make a fist for about 30 seconds. At the same time, apply pressure over both the radial and ulnar artery. After 30 seconds, ask the patient to open their hand, which should appear blanched. Remove pressure from the ulnar artery while maintaining pressure over the radial. If there is adequate blood supply from the ulnar artery, color should return within 7 seconds. Arterial blood gases, or ABGs. Arterial blood gas measure the pH and the levels of oxygen and carbon dioxide in the blood from an artery. An arterial blood gas is drawn following these steps. Use one hand to palpate the radial artery. Insert the needle using your other hand at an angle of 30 degrees. Aim towards the pulsation you are palpating with your non-dominant hand. As you puncture the artery, you should observe bright red flash back into the needle. The needle should begin to fill itself in the pulsation manner. Once the required amount of blood has been collected, quickly remove the needle. You should immediately press down firmly with some gauze over the site. You should press down firmly for at least 5 minutes.
Hey, Linda.
Hi.
My name's Emily. I'm the charge nurse here. How you feeling? Okay.
I'm gonna get your temperature. We just gotta see
Alright.
how it's.
Have you gotten her last set of vitals yet?
Yes, it was 114/74. Pulse ox is 98. Respiration's 14. And temp is 97.8. And pulse is 92. I'm gonna.
All right, so we got her EVGs back. She's going, she's running a little low. She's in uncompensated respiratory acidosis right now, so I'm going to give the doctor a call, get him down here, have him evaluate her, and I'm going to see what he wants us to do, okay?
Okay. I'm gonna turn the oxygen down to 2 liters, and she's down to
All right,
she's at
Candy,
98%.
I'm going to go give the doctor a call and get him updated on your stats, okay?
Whatever.
I'm
You
gonna
feeling
get
okay? You a little too warm, or are you feeling good?
I'm alright.
Okay. Linda's going to take care of you, all right?
I'm gonna get a head to toe assessment.
Okay, sounds good. Hi, Dr. Boleyn. This is Emily calling back from ED concerning Candy Johnson. Birthday is 7/31/88. We got her stat EVGs back. She's at pH of 7.28, PCO2 of 60, and HCO3 of 26. So she is down in uncompensated respiratory acidosis. We were able to bring her temp up to 97.3. Her Glasgow coma has gone up to 14. Her last set of vitals was 98.4 for her temp. Her BP was 114/79, respir's 14, and we got her SpO2 up to 97%. What would you recommend? What would you like us to continue with her? Okay, and then would you like me to put a consult into psych for her? Okay, so I will put in a consult for psych right now, and then I will also put in a note to admit her to 5 West Med Surg until she is stable. All right? Okay, thank you. Bye.
Hi. So what brought you in here today?
I don't know, they made me come to the floor.
Who made you come to the floor?
ER, I guess, I don't know.
Well, why were you in ER?
Because I'm a drug addict.
So what types of drugs were you doing?
Heroin. Duh.
Heroin. You don't think being a heroin addict would affect your family at all?
No, I love being a heroin addict.
I don't really know why anybody would, but why?
Why? Because it makes me feel better, and if it means I have to stay out of places like this just so I can get high, then that's fine with me, because this sucks.
Well, you are young. What could have possibly happened to you in your life to make you feel like you need to get out of it?
You don't know my life, you don't know my stories.
Are you going to talk to me about your life?
No, because I hate your attitude and the way you're treating me right now.
Well, you know, drug addicts, in my opinion, I'm a mental health nurse. I'm here to deal with bipolar, schizophrenia, depression. I'm not here. I think drug addicts are a waste of my time, honestly. So if you don't want to talk to me, I don't know how I'm going to help you.
No, good for you. Well, you know, if this is what help is like, then I don't want it.
Well, I have to say that I've at least tried to help you, so let's just try to talk a little bit.
We both know that you haven't been helping me.
You know, why don't you, if you would be a little, open to help, see, this is the thing. Drug addicts don't like to admit that they have a problem. So if you could actually admit that you have a problem, then
I know I have a problem.
All right, so there you go. Step 1. Good job. What do you want to do about your problem?
I want to keep my problem and I want to get high again because this sucks.
Why does this suck? I mean, there's multiple people here. You don't think that you can take the time to talk to somebody?
Not with your attitude like that.
Well, what if you don't want to talk to me? You can't talk to another patient?
I could, but what are they going to do? They're in the same issues that I have, so...
I don't know. I don't know how a drug addict's mind works, and quite frankly, I don't want to know.
You know what? This is ridiculous. My pink slip is up, and if this is how help is, then I don't want it, and I would rather be dead on the streets.
Huh.
but thankfully that's not how my story went.
Hi, Candy.
Yeah.
Hi, I'm Heather. I'm going to be a nurse today until 6 o'clock. I'm going to talk to you for a few minutes, okay?
Go for it.